Welcome, everyone. Thank you so much for joining us tonight. My name is Caroline Riseborough. I am the president and CEO of Trillium Health Partners Foundation, and I hope everyone is staying warm and most importantly, healthy and safe during these times. I am just absolutely thrilled to be here with what is just a stellar panel of special guests because they are actually leading experts on COVID-19. I'm joined by Dr. Matt Robinson. He is the medical director as well as the lead of our THP COVID-19 vaccination program. So we're thrilled to have Dr. Robinson. We also have Dr. Laura Rosella. She's an associate professor at the Dalla Lana School of Public Health with U of T, but more importantly, she is one of our lead scientists at our Institute for Better Health. And in particular, she holds the Canada Research Chair in Population Health Analytics. So we're thrilled that Dr. Rosella is here. We have Jane Bishop. She's actually the patient lead for our entire COVID-19 vaccination program. So very well informed on everything that's happening with our vaccinations here at Trillium Health Partners. And then Kyle Johansson is with us. He is the operations superintendent for the paramedic Peel Regional paramedic services. And what's so important is that Kyle is actually part of a joint partnership between Trillium Health Partners and paramedics of Peel Region. So we're going to tell you a little bit more about that partnership. We are thrilled because everybody here is going to talk to you about the mass vaccination plan framework and the critical role that Trillium Health Partners is playing in rolling out the vaccine strategy to the community, which many of you will be impacted by this. So a big welcome to all of our guest speakers. We're so happy to have you with us today. Thank you for making time. I know you've taken time out of your time with family and the other work that you do. So again, just a big thank you on behalf of the foundation and all of the donors with us tonight. Before I turn it over to our panelists, though, I just want to say a few words. If you can believe it, I'm actually almost at my 1-year anniversary with Trillium. I started a few weeks before the pandemic hit, which means we've been living in this sort of new COVID world for almost a year now. And I think it's fair to say that this year's brought many challenges, but I think we can all take comfort in knowing that with the arrival of the vaccine and its rollout, along with all of the progress that we've been making in understanding COVID-19, there is definitely light at the end of the tunnel and some reason to be optimistic, which we hope you walk away with some information tonight that will really create some optimism. Trillium Health Partners has a dedicated COVID-19 vaccination team in place and has been working with all levels of public health to administer the vaccine to key populations as quickly as possible. And as I mentioned earlier, we have also partnered with the Peel Region paramedics team to help with vaccine distribution, and they have just been an incredible asset in this process. I'm really looking forward to talking with Kyle a little bit later about this partnership. And I know the vaccine will help us eventually sort of return to normal. I think the number one question that I've been receiving from our donors and from the community is just really about the vaccine, some of the uncertainties about the vaccine rollout, what's happening with the strategy, and then even some particular questions about the vaccine itself, its safety and others. So we're going to address all of these questions tonight. Thank you, because we did receive a number of questions from our donors. And in fact, it was the questions that we received from you that actually inspired this panel tonight. So before I turn it over to our first panelist, I just want to again thank you, all of you who have supported us throughout this past year. The support from our community has truly been a critical source of support and help for our community here at Trillium Health Partners. And recently we ran an ad in the Globe and Mail on January 23rd, where we announced that our donors gave a historic $75 million to Trillium Health Partners Foundation in 2020. And more important than the number we raised is the fact that you are partnering with us to build a new kind of healthcare. The impact that the money we've raised has had on patient care, ability to strengthen our health services here, strengthen the system, to keep and inspire our healthcare workers who have truly had no stop for the last year and have been making immense sacrifices. From the bottom of our hearts at the foundation, we just wanted to say thank you once again for all that you are doing to support us. As you know, we couldn't do this without philanthropic support. Philanthropy plays such an incredible and important role in our healthcare system. So a big thank you again to our donors. So now I would like to turn it over to Jane Bishop. Jane is going to speak about Trillium Health Partners' role in administering the COVID-19 vaccine to our community. So Jane, a very warm welcome and over to you.
Thank you, Caroline, and good evening, everybody. Delighted to be here on this panel this evening. So my normal role is continuous improvement and transformation lead for Trillium Health Partners. But like many of my colleagues, we've been reassigned multiple times in the last year in our fight about COVID. And my most recent assignment was to go and help the team that had already started to set up the vaccine clinic. So my background is ED nursing, and I think that really came into play in the first couple of weeks when it was all about the fast and the furious and trying to get an awful lot of people through our clinic, which you can see in some of these pictures was actually in our pandemic response unit, otherwise known as the big tent in the parking lot at mSite. So THP is very proud to play a role in the vaccine in Peel region community. And I think what I want to share with you here is some of the highlights of what that's been like since we started in December 2020, which was when we were actually designated as one of the 17 hospitals to administer the vaccine. So in true THP style, we got right at it. We knew we needed to meet with speed. And so on December 9th, I believe, the team started to look at what it is we needed to do this. Clearly, we have never run a COVID vaccine program before. And so there was a lot of lessons to be learned. And so we set about trying to get it up fast and mobilize a really class team, which we did. And when I talk about the team, it's everything from our physicians, our nurses, our clerical staff, we have pharmacy staff, we have our housekeepers that were a key part of this as well. And trying to get us all up to speed and move quickly was quite the challenge. On December 21st, we were so proud to administer our first vaccine. And that was to a nurse called Bella, who is from Camilla Community Long-Term Care. As you know, that's beside us here on mSite, and it's been one of our hardest hit long-term care homes in the region. So that was quite an emotional moment, and everybody took a minute to pause, socially distanced, and reflect on really what this meant. What was this first vaccine all about and where we were going from here? I think from there, we just ramped up very quickly. We realized that we had an awful lot of people that we needed to try and get to very quickly. And so we ramped up on a daily basis. And what we tried to do, I would say, is at the beginning, we found it difficult to get maybe 250 staff through without it feeling a bit clunky, and we weren't so good at it. But as the days went on and we engaged the team with what could we do better, we refined the process pretty quickly. And I think within maybe 48 hours, we had managed to go from 250 to 650 without it feeling difficult. So we were very happy about that. So we began to realize we couldn't stay in the pandemic tent either for much longer because we may need it for patient capacity. So in January, we made the decision to move to our J-Wing auditorium, and that unlocked even more capacity for us. What it allowed us to do was to add more vaccination pods. It allowed us to refine our waiting process, add more chairs. And so it allowed us to go faster, quite frankly. So we've been very keen to show it off. And in December, we had a visit from Mayor Comby, Premier Ford, and in January, we had General Hillier in as well. So that was very exciting for us and really rewarding for the staff actually to have such esteemed guests come and visit. What we felt was going with military precision. I'm not sure that General Hillier would agree, but it was pretty good. So I think another highlight and what was different with our clinic maybe was our partnership with Peel paramedics. That was incredibly rewarding. They came in with us to train on every aspect of how to run a clinic. Literally from start to finish, they could do every single job in that clinic, and they made an incredible contribution to us. So it was really a really success story with our partnership with them. So I would say where we're at today, as of February 17th, we've managed to vaccinate over 16,000 people who, of course, are frontline workers, are workers in our long-term care homes, our retirement homes, and our medical responders, our first responders. And I think if I was going to say lessons learned, we were so busy trying to get logistics right, wondering about vaccine, what was the right flow, what was the right numbers, that we were completely taken aback by the reaction of our staff and the staff from long-term care homes when they started to arrive. And we had everything from absolute tears of relief of what this meant. We could see the weight of what these people had been carrying for a year. And then we had people doing happy dances, singing, and all sorts of things going out of the tent. And so we started to call it the happy tent. And it was the one place in a whole year that had very little good news associated with the word COVID. This was suddenly the happy place where we could say COVID and everybody was smiling, or tears of joy. So I know that you saw in some of the screens here, this is what we decided to do. We realized there was a moment in history here, and we started to ask the staff to tell us, how do you feel now that you've been vaccinated, whether you're crying or laughing or smiling? And so we've started this wall of gratitude, and everybody leaving in a very safe way. We're very careful. They get to write what they feel. And one of the first things that's up there on the screen was, it's like Christmas morning. And that's what we heard over and over again. The best gift that we could give these people was the relief of knowing that they were on their way to being fully vaccinated, and that a year that appeared to have no hope was totally ending in a different way. So I think what I would leave you with is literally what a wonderful thing it is that this is where we've started. We really look forward to the day when we have enough vaccine to open to each of you and to the community, and our work continues, and we're absolutely ready.
Thank you so much, Jane. And I know that a lot of our nurses, and especially those working in frontline care, were very worried about coming in and bringing COVID to their patients. And so we'll talk a little bit in a second about why the framework prioritized healthcare workers and why that's so critical. So Jane, thank you so much for sharing that. And I'm actually going to start now and pivot and actually ask you questions, and I'm going to be asking the rest of the panel questions. And I'll say that I'm going to start off with probably the most popular question that we get from donors. And that is simply this: how will I be notified when it's my turn to get the vaccine, and where will I go? And I think there's this sense that folks are somehow going to miss the call, and that means they're going to miss their vaccine. So Jane, maybe you can just talk to that and just reassure folks how things are going to roll out.
Unfold, for sure. Thanks, Caroline. So it's actually Peel Public Health that's actually coordinating the mass vaccination. And so we take our direction from them. So we're happy to support in any way we can to help them roll that out efficiently. So at the moment, the focus is still on those frontline workers in patient-facing roles, and the residents and the staff in long-term care homes. But once that group opens up, information is going to be shared broadly with the community, and that's going to include when and where to go for your vaccine and the location of our mass vaccination sites.
Okay, great, thank you. And Jane, one of the questions we've had for folks who have actually had COVID-19, they've recovered, they might potentially have the antibodies. So the question is, if I've already had COVID-19 and I've recovered, or someone in my family has, do I still need to get the vaccine?
In a nutshell, yes. And the reason being is, while you might have some immunity from COVID-19, we're not actually sure how long it lasts or if it weakens over time. So currently the recommendation is, even if you have had COVID-19, that you would get the vaccine, just to give more lasting immunity. So probably the best way to look at it is if you've actually had the virus, consider the vaccine like a booster shot. That's going to make sure that you have, you're protected from further infection.
Another question that we've received is about those who have either received the 2 doses of the vaccine or they're in one of the priority groups and they're about to receive the 2 doses. Do I need to wear a mask anymore? And do I need to continue to social distance, or can I just kind of go right back to normal? Jane, what is the recommendation on that?
You know, it's a great question, and it's actually one that was asked so often in the beginning that we had to keep reiterating. The answer is absolutely yes. We continue to follow public health guidelines, and it's critical after you've been vaccinated. The reason for this is, even though studies are showing it's got high efficacy, it's not 100% effective. And so we still need to be careful and follow public health guidelines. I think secondly, we're not yet sure if there's an impact on viral transmission. So for this reason, we're absolutely saying we need to continue to wash our hands frequently, wear a mask, and continue to be physically distanced at this time.
Okay, excellent. Thank you so much, Jane. We so appreciate all of the kind of insight that you've given us. Thank you for all that you are doing in our vaccination clinic and with our vaccine rollout. And we really appreciate it. Before I go to Dr. Robinson, I know some folks are raising their hands in the chat. We're not taking live questions right now, just because we have a whole list. We want to make sure we get through them. But if you have questions, please send them to foundation@trilliumhealthpartners.ca. That's foundation@trilliumhealthpartners.ca. And we will get answers to your questions and we will loop back with you. So please do email us. Again, it's foundation@trilliumhealthpartners.ca. Dr. Robinson, you are the physician who is helping to lead the vaccine program. And I've actually asked Dr. Robinson to go into some of the science a little bit here, because I think sometimes we've gotten answers, but folks want a bit more detail. So heads up, Dr. Robinson is going to get into a little bit more of the science as we ask these very sort of popular COVID questions. So just to kick us off, Dr. Robinson, can you maybe just provide a bit of insight in terms of what is happening right now in the hospital with respect to COVID and the pandemic?
Thank you, Caroline. And let me begin by echoing what Jane said. And I feel like I'm speaking for my colleagues as well, but a big thank you to the foundation and to yourself for hosting this event tonight, of course, and a big thank you to our donors for their time this evening. It's truly an honor and a privilege to be here and to share our time and share our expertise with everyone. It goes without saying, Peel region is one of the areas in the province and the country as well that's been disproportionately affected by COVID. There's been a significant number of cases here, especially on a per capita basis. And like many hospitals and healthcare systems, what goes on in the community is mirrored within the walls of the hospital. And so although we were one of the institutions that was most affected by this pandemic, we are seeing now some positive trends as the case counts in the community are dropping. That is being mirrored within the hospital as well. However, we're still looking after approximately 51 patients with active COVID-19 disease presently, and that's both at the Credit Valley site and at Trillium Mississauga. These are patients that are admitted to our specialized medical units, our COVID-19 units, and patients as well who have significant illness and significant care needs and remain admitted to the intensive care. So although lots of positives are being seen, this is still a time where we are looking after sick patients and we're providing the care the community needs. I would like to take a moment to highlight that we've had some strategic partnerships develop over the last few months. Neighboring hospitals and healthcare groups have taken on patients and transferred patients out in support of our organization, and we're thankful for their assistance. Some of the donors in attendance tonight are likely aware that at the peak of the second wave, we had to scale back, unfortunately, some elective procedures within our hospital, and we are very hopeful now that cases are improving, and we're seeing that ray of hope, that light at the end of the tunnel, that we'll be able to continue to provide care for our community of the highest quality and give everyone the access to care that they require. So we are seeing a lot of positives. I want to stress that. It is a time of uncertainty still, and a time for vigilance, and a time for us to adhere to our public health policies. But we are hopeful at this time. And I think the trend overall is for the positive.
Thank you. Great. So I'm going to start off with asking you a question about one of the myths out there. And that myth is that if I get the vaccine, it is going to give me COVID. And, we've heard some stories of folks, feeling quite unwell after receiving the vaccine. Can you maybe answer the question, can the vaccine give you COVID?
So the short answer is no. The vaccine cannot give you COVID-19 or infect you with COVID-19 and cause COVID-19 disease. I'll briefly explain sort of how vaccines work so that we can have an understanding of this. But there's really nothing within this vaccine that can infect you with COVID. So all vaccines work by teaching our immune systems to recognize the causative agent of an illness, in this case, a virus. Vaccines do this sometimes by containing a live virus that's been treated such that it's less infectious. Vaccines such as the MMR vaccine contain a live virus. That's the measles, mumps, rubella vaccine. Many of us get in childhood. Other vaccines contain small portions of viruses, often that are created in a laboratory. And an example of that would be the hepatitis B vaccine. This is a vaccine that doesn't contain an active infectious agent. And in fact, it doesn't contain a component of a virus. What it actually contains is a blueprint to make a component of the virus. So it contains RNA, which is, if you will, a Xerox copy of the virus's genetic material. It doesn't contain any of the other infectious parts of the virus. And this RNA really only allows our bodies to make a small segment of the virus called the spike protein, or what I like to refer to as the sticky protein, because this is the protein that sits on the virus and allows it to actually get into our cells. And so by exposing the body to that RNA, the body can make that protein and then mount an immune response to it and protect us going forward. But there's not enough genetic material there, not enough viral material to actually form infectious viruses or cause the infection. People have asked, why is it we're hearing about individuals who are getting sick after they get the vaccine or developing COVID infection? Again, Jane mentioned this. The vaccine is not 100% effective. It's very effective and better than most vaccines out there. Comparatively speaking, it's much better, for instance, than the influenza vaccine. But there's still a small chance you could be infected even if you're vaccinated, or there's also a chance that you could have been infected without knowing it when you were vaccinated as well. And so to reiterate, there's no chance you can develop COVID-19 from this vaccine, and it is safe and effective.
Great, thank you. So kind of going on to the whole question about, are the COVID-19 vaccines safe? And I think, many times we've seen vaccines develop, they can take a decade to develop. And with the COVID-19 vaccine, it was developed quickly, but perhaps some folks don't know that there's actually been some work on the technology of this vaccine that's been undertaken many years prior. So Dr. Robinson, can you just talk about the safety of vaccines, even though this was approved very quickly, and why this is indeed safe?
Absolutely. So Caroline, I think you hit the nail on the head. This is a vaccine that's been in development for a long time, based on technology that's been well studied for at least a decade, if not longer. But the time frame for its approval was actually quite short when you think about it. And so I'm going to break the question down through a couple lenses. Foremost, again, the genetic technology that was used to create that RNA is something that's been studied for years and years. It's actually been used before, both in veterinary vaccines and also in human vaccines, although this is the first set of vaccines that have been fully approved that use this technology. It was used, RNA technology was studied previously to create vaccines for other viruses. They were simply viruses that didn't cause a global pandemic the way COVID did, and so the vaccine sort of came and went. And so foremost, this technology, although approved relatively quickly, has been around quite a long time and has been well studied. Secondly, is that there's this perception that Health Canada and other licensing bodies sacrificed safety or potentially cut corners to speed up the approval timeline, and that's absolutely not the case. Health Canada's approval process is one of the strongest in the world. It has very rigorous standards. One of the things that was done instead to speed up the process was they actually allowed for what's called a rolling submission. And so instead of sort of submitting all the data from the trials once they were completed, they actually allowed data to be submitted in real time. And that gave the investigators at Health Canada a chance to review things as the trials unfolded and sort of help to expedite the approval process. Lastly, I want to stress that the size of these trials is impressive. The Pfizer trial had over 40,000 participants. The Moderna trial had over 30,000. They were diverse trials run in multiple centers across the globe, and they were published in incredibly well-respected peer-reviewed journals. They were both published in the New England Journal of Medicine, which is a premier journal. The side effect profile for the vaccine was well-established in the trials and well-reviewed. Again, it's comparable to many vaccines our audience is likely familiar with, including the flu vaccine. And overall, although this process seems quick, the vaccines are believed to be safe and, again, quite effective in preventing COVID-19 disease.
Great, thank you. And thank you for going into a little bit more detail there, because I think that's helpful. And then also just to know that Canada actually has some of the most rigorous standards, I think actually is very helpful. So here's a question that we've received from some of our donors. Who should not get the vaccine?
This is a great question. And there's actually only a very small segment of the population who would truly be ineligible for vaccination at this time. Foremost, Health Canada approved the vaccine on the basis of the demographics of people in the studies, and children and young adults were not included. So for Pfizer, that means anyone under the age of 16 was excluded. For Moderna, that means anyone under the age of 18 was not participating in the study. And so children and young adults, as it stands right now, the vaccine is not licensed and approved to be used in that group. It is being studied in that group presently, and I suspect it'll likely be found to be safe. But as it stands right now, young adults and children are not eligible to receive the vaccine. The other main group that can't receive it is individuals who have a proven allergy either to this type of vaccine or to specific components within the vaccine. And the big sort of allergic molecule, if you will, in the vaccine is a stabilizing agent, a preservative called PEG, or polyethylene glycol. Many people know they're allergic to it because it's contained in a variety of household products, cosmetic products, detergents, etc. And so if you truly are allergic either to one of the vaccine components, and we ask everyone who attends the clinic about this, or if you've had an allergy to another vaccine that contains similar components, that is one reason to potentially not receive the vaccine. But otherwise, there's very few restrictions on who can receive it currently.
And Dr. Robinson, how about folks who have autoimmune or immune compromised conditions? Are they also a group that should not receive the vaccine, or what's the government guidance on this?
So if anything, I would say they're a group that should consider being vaccinated because they're at increased risk of developing significant COVID-19 related complications. As you can imagine, if your immune system isn't functioning at 100%, the chances of you developing a severe infection, whether it be COVID or otherwise, is obviously a lot higher. And so this is a group that should pay special attention to potentially receiving the vaccine. They are labeled what's called a special population by the government. There's a group or several groups of individuals, categories of individuals with certain illnesses and conditions that either were not readily studied in the trials or require special considerations to receive the vaccine. And individuals with autoimmune illness or who are on drugs that may affect the immune system fall into that category. They were excluded from the trials because, as you can imagine, if your immune system is compromised in any way, you may not respond to the vaccine comparatively as well. And as a result, that could affect the trial results. And that is a worry for individuals in this category. If they are vaccinated, they may not have the same immune response, but they will still develop a protective immune response. And so we encourage them to consider being vaccinated. I'll add that anyone who falls into that special population, which includes autoimmune conditions, pregnancy and breastfeeding, and individuals with some other types of allergies, they should consult with the physicians or the specialists that are most responsible for looking after those conditions before receiving the vaccine, just so they can make an informed choice whether the vaccine is appropriate for them or whether any other considerations need to be made around the time of vaccination.
Okay, great. There's been some, articles in the paper and even news reports about side effects being caused by the vaccine. Everything from kind of, feeling aches and pains or fevers. There's even been some sort of other mild side effects too. Can you really talk, to our donors about any of the short and long-term side effects caused by the vaccine?
So I'll start by discussing short-term side effects. And the majority of side effects that were documented in the trial were, again, similar to what you'd expect with many vaccines. And probably many of our donors are familiar with this. When you have a flu shot or any other vaccine, you might feel fatigued, achy, have a bit of a headache, even have a bit of a sensation of having a fever. It usually lasts an evening or a day or two, and then it's self-limited. It resolves on its own. Sometimes you need some help from some Tylenol, but generally these are more of nuisance symptoms. And many of us in the medical community, I can say, when we experience these symptoms after vaccination, we're often reassured because it's a sign that our immune system is kicking into gear, it's working, and it's mounting an immune response. And so the majority of side effects seen in the trials were related to this. They were common, but again, they were in keeping with what we'd expect from any vaccine trial, really. In terms of long-term side effects, the studies that were done spanned months. We don't have any definitive knowledge if there are any long-term side effects, but based on what we know from expert opinion at a physiology level, at a biology level, from comparable vaccine studies, as well as how this vaccine works, the mechanism of action I described earlier, the RNA technology, it is unlikely that there'll be any significant long-term side effects. And I'll add, for those concerned out there, this RNA has no way of interfacing with your DNA or affecting your DNA or your genetic sequence or code long-term. The vaccine that's injected breaks down over the course of several days and is not permanent in any way otherwise, other than the immune response it mounts.
Excellent. You sort of answered, I think, my last question to you, which was, can the mRNA vaccines actually change the DNA of a person? And so the answer is no.
Yeah, it's an absolute no. Again, just a few things from a scientific level. The RNA is, as I said, that blueprint that helps us make the spike protein that we then mount an immune response against. Humans have no means of turning RNA backwards into DNA, from which typically it originates. And furthermore, the RNA has no way of entering the nucleus of the cell, the center of the cell where DNA resides. It stays outside of that region of the cell. And it also breaks down, again, on the span of a few days. It's not a permanent injection. The only permanent fixture, or hopefully permanent fixture, is the immune response that results from this vaccination.
Excellent. Thank you so much, Dr. Robinson, for taking the time to answer all of these questions, including, I think, busting some of the myths that are out there. We very much appreciate it. I'm going to pivot now to Dr. Rosella, and I think one of the questions that is probably top of mind for so many of our donors, and really for the entire community, is this whole issue of vaccine supply and demand. It makes the headlines every day, and I was just reading a couple days ago that obviously Canada is not keeping pace with many other countries, particularly G7 countries, in terms of the issue of vaccine supply and demand. So Dr. Rosella, can you maybe just talk about that? What is happening with supply and demand?
Thank you, Caroline, and thank you for including me in this great panel. So, I mean, there's several steps that have to take place to secure a vaccine supply. The first step was actually securing the contracts with the vaccine manufacturers, and Canada did very well there and secured those contracts very early. Now it's time for the contracts to be fulfilled. And as many are hearing on the news, there has been some delays in the delivery, some factories. Most of the factories where we're getting vaccine from are in Europe, have had shutdowns to enhance their vaccine production. So there's been some delays, some cancellations, and all of that could not necessarily have been anticipated early on. So we're experiencing a bit of delay in the delivery of those vaccines. We have been assured by federal authorities that the production and the delivery is back on track, and within the next few weeks should be receiving the next substantial delivery of doses. And then you hear the next stage, which Jane so beautifully described in the beginning. It's the rolling out process, and that complicated but important process, which lots of people are planning for now to get those vaccines to individuals. So today, very positive news. Looks like we'll have, almost enough doses for 15 million Canadians to be vaccinated by June. With the caveat, there could be disruptions that may or may not be predictable, but it looks very positive and reassuring at this time.
Excellent. Well, that is hopefully positive news for everyone. Dr. Rozzella, we've been talking from the very beginning. I heard you talk about this whole concept of herd immunity, and that we need to have a certain amount of immunity towards COVID-19 to kind of get back to normal. And I'm sure folks are curious when we're going to kind of get back to normal. And maybe you can sort of address the question of what percentage of the population needs to be vaccinated in order for life to return back to normal?
Right. It's a great question. One thing I'll say about herd immunity right at the start is that it actually depends on the particular virus or causative agent. And so for some viruses like measles, you need a very high level, some viruses lower. With COVID-19, we're not 100% sure, but we rely on modeling studies and what we understand about transmission dynamics of the virus that we've been studying for the past year to estimate this. And from those studies, generally around 60 to 70% of the population is thought to provide herd immunity. I personally think it's probably a bit higher, at least 70 to 75% of the population. So that's what we're looking at to achieve herd immunity. We have to, that's what's being planned for in all the vaccination strategies, to vaccinate as much of the population as possible.
Great. And there's been millions of vaccines delivered, not as many in Canada, but around the world. We know that there's been millions of them delivered. What has been the impact then in jurisdictions where there's been a greater percentage of the population that has been vaccinated? What are we seeing in terms of some early results?
Well, this is Caroline, where I'm very happy to share some very positive news, really actually tremendous news. We heard from Dr. Robinson the results from the trials, and we had that data, and it's been very well vetted. Now what we see is what we call real world evidence. In the countries like Israel, where they've achieved very high vaccination rates, they've been very successful. There's been, frankly, a tremendous drop in COVID infections, as well as hospitalizations and death due to COVID. Around, 50% reductions in cases since January in Israel, about 40% reduction in hospitalizations, about over 35% reductions in death. And that's, pretty remarkable reduction seen, and very positive news. The other thing is, we have the trial data where we see the results, and then we can do actually real analysis on observational data. We compare people that have received the vaccine compared to those that have not in a very detailed, rigorous ways. Another important analysis that we do as scientists. And from those data, for example, from the Pfizer vaccine, we are seeing over 90% reduction in symptomatic COVID cases. That's really significant, because typically when you get the results from the trial, that's our gold standard. And then when you see the real life results, they tend to be a little bit less, just due to the real life situations. But we're actually seeing comparable impact in the real world data as we were seeing in the trial, which is very reassuring, very positive news, and very positive for us, knowing that when the vaccine does roll out, we will likely see very similar reductions in our setting.
So we promised our donors and everybody who's tuned in tonight that there would be some positive news. So, this along with even some of the other news from Jane and Dr. Robinson, I hope is encouraging to everyone. But there seems to be this sort of dark cloud because we keep hearing about these new variants. And I know you were telling me before that there's been lots of talk about new variants and their impact. Can you talk just a little bit about the new variants? What does this mean for the vaccine if new variants develop? And maybe just in general, are these new variants more contagious? Are they more lethal? Maybe you can kind of just, again, give us sort of the truth of what's happening here.
Right. So what's important to note about variants is it's a very, normal and typical thing that viruses do. They replicate. When they replicate, their genetic material sometimes makes mistakes. As they make mistakes, a new variant is formed. And there are many variants which are what we call very benign. You'll have a little change to the genetic information, won't really notice the difference, doesn't really change much. There have been a few what more generally called variants of concern, where the shift has been significant enough that it changes something about the virus, perhaps how it's transmitted or its impact to the body. And there's been 3 in particular, although there's been many variants, 3 in particular that we've been monitoring, the B117 from the UK, and there's been another one originating in South Africa, another one originating in Brazil, the P1, and the B135 from South Africa. So what's the big deal about all these variants? What do we need to know? We're hearing a lot about it. So the main thing we need to know is that they are variants, small shifts that can have an impact slightly on the virus. For the most part, it's still the same virus, still acts the same way. Everything we know about it, all the measures we've been putting in place, they still work. They still need to be continued. Nothing else significantly needs to be modified. With respect to the vaccine, that's what we're most interested in. You've heard the explanation before about how the vaccine works. Are these changes enough to change actually the response that we're going to generate, given that they were designed for a previous variant? And it looks like for at least the UK variant, the vaccine still works very well, so very positive. There's some early data, but this is being assessed very early on, that it may not work as well for the South African and the Brazilian variant, but still works. So it's not that it works and doesn't work, it's that instead of a 95% or a 90%, is it going to be 85%, for example, or a little bit less? So it may mean that either the vaccine will have to be updated, you can again think of it like a booster, or there may not be as high an effectiveness, but it still will offer protection, especially given the population. So for the most part, it's very interesting, the variants. It's to monitor, we must monitor it. We must monitor the impact, which we are, but everything that we're doing still holds. The protective measures we're putting in place, the vaccine strategy, and of course the vaccine developers are ready to pivot if needed, if there's a significant enough shift.
Great.
And one thing I do want to say, just add on, that the variants happen when there's uncontrolled transmission. So as more of the population gets vaccinated, as transmission goes down, the probability of a new variant popping up will also go down. So that's something to be reassured.
More positive news, which is great. Yes, good. I'm going to ask a question that I have also received from donors, which is why our policy is such that we're looking to vaccinate healthcare workers first versus, let's say, focusing on those who are, let's say, 80 plus and most at risk of COVID complications. Can you just talk, because you sit at some of these policy tables and you actually feed into them with data and analysis. Can you just talk about why Canada took this approach, which some countries took a different approach, and why this is so effective?
Right. So when thinking through vaccine priority, there are many things to consider. Who should get vaccinated first and why? And obviously the most important and is really our approach in Canada as well, is who's most at risk from having a serious complication, hospitalization, death, or vulnerable otherwise. And that's why long-term care, for example, was top of the list, as well as those that care for individuals in long-term care. Individuals 80 and older also at high risk. They are very high up on the priority group. And I would say although some countries have differing approaches with healthcare workers, the vast majority have healthcare workers at the top of their priority list. And the reasons are pretty clear, and I would say, really important. So we need our healthcare workforce. Our healthcare workforce is critical to saving lives. They save lives of people with COVID. They save lives of people without COVID. And it's an essential aspect of our society to have a functioning workforce. The other thing is these healthcare workers are interacting directly with vulnerable patients. So individuals that have comorbidities, individuals that are immunocompromised, in older individuals in long-term care with multimorbidity. We need to make sure that they have the protection so they can protect their patients around them who may or may not either be able to get vaccinated, have the same immune response. And so it's essential, given that they interact in the closest possible way with the most vulnerable patients, that they're protected. So those are the main reason why front care providers and healthcare workers are at the top of the priority list. And, again, as I mentioned, really consistent across the world in the approach that's been taken.
Excellent. Well, thank you so much. Thank you for all the work that you were doing to, again, shape even our public policy, and really appreciate you being here tonight with us. Thank you, Kyle. You've been waiting patiently for us. You're last but definitely not least on our list tonight. And I thought maybe we could start with just a kind of overview question. Why are Peel paramedics partnering with Trillium Health Partners when it comes to COVID-19 vaccine and its distribution?
Well, first of all, thanks for having me. I'm very humbled to be amongst this company. So thank you guys so much for including me and including us. And I will start to talk about the partnership. So when we first sat down with our partners at THP about how we could work together on this project, we felt that the versatility of paramedics was our real strength. Outside the clinic, the skill set of modern paramedics is incredibly advanced and broad. We're able to bring many elements of the emergency department directly to patients in the field, and adapting to new environments and situations is really what we specialize in. So because of that, we were able to bring our skills to fill any roles that THP needed. Jane touched on it earlier, but the obvious starting point is, of course, administering the vaccine itself, or needles in arms, as we say. But we're proud to be able to contribute to the entire pipeline. We did check-in, screening, vaccination, monitoring patients through the checkout process. We helped the amazing pharmacy techs reconstitute the vaccine from cold storage. We worked the phones in the scheduling call-in center, and we had a couple of people mopping floors. So really, we're just happy to contribute in any way, wherever, whenever we're needed.
Well, thank you. I mean, that is sort of full service support, and we couldn't be more grateful. Maybe you could talk a little bit about just what does our partnership mean, particularly to the Peel paramedics. We know what it means to us and how grateful we are to, again, have sort of more hands and feet to support with this significant effort. But what does it mean to you and to your colleagues as paramedics?
Sure. Well, first of all, it is not new at all. So we've had an amazing partnership with THP for decades. Trillium Hospital does wonderful work serving the community, but very often a patient journey, as we call it, actually begins at home and with pre-hospital care. So that's where we come in, of course. Our partnership also allows us some special considerations which benefit your patients tremendously. So for example, we can diagnose a heart attack right in the field, right from your couch. We have a line directly to THP cardiologists, which allows us to actually bypass the emergency department altogether and get patients direct access to life-saving angioplasty, cardiac surgery, things like that, often within an hour from the first call to 911. That's really the fastest in North America. So because of our partnership with Trillium, Peel region is actually the safest place in North America to have a medical emergency. So applying this special relationship further to the vaccination clinic is just a natural fit.
Excellent. Thank you, Kyle. And maybe you can talk a little bit about what the future is going to look like in terms of our partnership on the vaccination program and the future role of paramedics in that.
Right. So the future is still sort of taking shape before us, but at this point, the high level planning discussions continue. But the hopes that we'll continue our partnership with THP both on the local scale and then with any potential program expansion. So there's likely to be some regional led initiatives as well, which do reach beyond THP, but the plan is still to bring our experience and really the best practices that are learned at THP to the mass vaccination platforms that you'll see coming up in the spring and the summer. It's very obviously a successful model conceived at at Trillium, and I think that can be scaled to serve any number of different community environments, very small or very large. So I think the THP DNA, as it were, should be a notable influence and have that stamp on any of the broader plans moving forward across the province, really.
And then maybe you can talk a little bit about how this partnership actually has implications across all of Ontario with our partnership with paramedics.
Yeah, so it's been an amazing opportunity to actually just demonstrate the scope of our abilities. It was in the media early in the winter, and many of you guys likely saw that paramedics were not initially considered to be healthcare workers at all when public health was evaluating phase 1, phase 2, things like that. Which just tells me that as an industry, we have to do a much better job of showcasing the advanced skill set that paramedics actually have. So fortunately, most people don't have frequent interaction with paramedics. That's a good thing. But the clinic is a really wonderful opportunity to interface with our partners at THP and with the public in a very positive setting. Many of the people we've connected with would otherwise never cross our path, hopefully, but we've been able to really highlight our skills and our utility and our professionalism to a much broader set of clients and neighbors, and that's been awesome and very important to us. Excellent.
Well, thank you, Kyle, and thank you so much for this partnership and just for everything you and your colleagues do. We so appreciate it.
Oh, thank you.
We have a little bit more time, so I'm going to kind of veer off script a little bit and ask a couple more questions that we've been receiving. But first question is, have any of you received your COVID vaccine, and what was it like? Kyle, do you want to kick us off, and then we can?
Yeah, sure. Yeah, I can. So I did. I was lucky enough to have received both my doses of the vaccine. So first of all, it was a huge honor and a privilege. There's a few billion people on Earth, I'm sure, who would give just about anything to trade places with me, and that gravity's not lost on me. I'm pretty emotional about it, to be honest, and I was at the time. In terms of the physical experience, it was nothing. It was a couple small little needles 3 weeks apart, and that's that. I know there's chatter about the expected effects afterwards, and I experienced the mild chills, but frankly, I actually felt worse after my flu shot last fall. So on a personal note, it was really meaningful to have my shot actually administered by a paramedic, and it happened to be one of my direct reporting staff. So I think he was a little bit nervous with me in the chair, but it was special. And having this shot so critical for frontline healthcare workers, as has already been discussed, to help keep us at work, protecting the community, and also because we do want to minimize that potential risk of us unwittingly bringing disease into a home or a community if we didn't know that we were sick. So again, I'm not aware of definitive evidence one way or another on effects of transmission, but being vaccinated certainly keeps the whole community safer, and I'm thankful to be a part of that. So a great experience.
Good. Anyone else want to answer that question?
So I'll echo a lot of what Kyle said. For me, it was a great source of relief, and I was incredibly grateful and thankful to have received it. In terms of the actual process itself, again, simple needle, 3 weeks apart, and some very mild side effects. I think I had a bit of a headache and a backache that lasted the next day and resolved with some Tylenol, but really nothing else. It was very well tolerated. For me, again, similar to what Kyle described, as someone who works primarily with patients who are high risk on the basis of age alone, let alone their medical conditions, knowing that hopefully this would have a significant impact on transmission and protect them was truly a great reassurance. Knowing that I would be able to go back to work and both be safe myself and protect the people I'm looking after was one of the best gifts, and frankly, the best Christmas gift I got this year. So I was very grateful and very thankful to have received the vaccine fairly early on in this process.
Great. Last question, and then I'm going to wrap us up. Obviously, folks are taking really critical precautions right now. We're still sort of doubling down until there can be widespread vaccination. Any other sort of, words of caution for, folks that are just feeling a bit weary and are worried that, they might get COVID. Maybe you can speak a bit to just even some of the progress we've been making in terms of treating COVID. And I'm kind of thinking maybe Jane and Dr. Robinson, you might be able to answer that. So, while we're waiting, the reality is there's also been many strides in terms of treating patients. And maybe you could just speak to that as sort of our last question.
I'll close off by saying, foremost, in terms of what everyone should be doing, I'll echo what's been said throughout this presentation. I know everyone's concerned still. I know everybody's worried about variants of concern. The concern is in the name, so it's expected to be a little worried. The virus hasn't changed substantially. It's not airborne now. It doesn't stick to surfaces longer. It doesn't linger in the air more. So all of the public health measures that we've been suggesting for the last year, masking, maintaining physical distance when you do need to go out, social distancing, meaning, questioning whether you really need to go out now, grouping your trips out of the home, sticking to your immediate family when you can, if you can, washing your hands frequently. All of those public health measures still apply and still work and are still your best defense against the virus. I'll also urge everyone to think of this vaccine as just another form of PPE or just another public health measure. Again, once you are vaccinated, because it's very effective, but it's not 100% effective. And because we don't yet have any guarantee that it affects transmissibility, your ability to actually spread the virus, all of these measures are still going to apply as well. And so it's just another safety mechanism once you do get the vaccine. And so I'd urge everybody who I know has been very diligent for the last year and is probably, getting a little weary of this, that now's not the time to let up. We need to keep being vigilant for the sake of ourselves and for the sake of everyone around us in the community. In terms of the, sorry, Caroline, can you remind me the second part of the question?
Just the fact that, we know more about the virus now. And so even how we're able to treat folks who do come to us, the treatment has really improved. Maybe you can, again, just on our note of trying to create some optimism, give folks some optimism on that front as well.
Absolutely. And I'm wary of the time, so I'll be brief. Foremost, we know a lot more about this infection than we did a year ago. As many of you will recall, when it first came to light in the news, we were anticipating a fatality rate of 5%, even higher in the elderly population. We now know that it is not as severe, and that's partially because we just know more about the infection. It's also because we have treatments now. We know more about the actual management of these individual patients. We have drugs that we know have an impact on the course of illness. That includes things like steroids, such as dexamethasone. It includes antiviral drugs, such as remdesivir, which can affect the severity of the illness as well as the mortality associated with the illness. We are in a better place now than we are a year ago. Again, it's still a time to be cautious, a time to be vigilant, time to look out for those around us. But we are better positioned if you do become infected to treat this condition than we were 12 months ago.
Excellent. Thank you. Well, I think on that note, I hope for all of you who tuned in tonight, there is this sense of some light at the end of the tunnel. There is obviously a significant push ahead to ensure that we are able to vaccinate as many folks as possible, starting with those who are most vulnerable. We've got an incredible team of folks at Trillium Health Partners here who are helping make this a reality for not just our immediate community, but really at a regional level as well. I really want to say thank you to Jane, Dr. Rosella, Kyle, and Dr. Robinson for your time tonight. And again, we just appreciate everything that you're doing on this front to keep our community safe, to treat those. And there is lots of hope between both the vaccine, the treatments, and understanding what's happening. And most importantly, just want to encourage everyone to continue all the critical public health measures that we know work. A big thank you to all of our donors who attended tonight. We do this because we want you to remain informed. We want to be able to give back to you. And you've done so much to support us. We want to be able to support you with the most important information from some of our leading experts. So it is 7:59. I want to thank you again and just wish everyone a wonderful evening, and please stay healthy and safe. Thank you very much on behalf of Trillium Health Partners Foundation.